Elin Hab-Jones, Mentor Moch, North Wales Development Officer. I'd like to give you a warm welcome to the webinar tonight on parasites in pigs and how to combat them. Felly croeso cynnes I chi gyd heno I webinar ar parasitiaid mewn moch a sut i'w trechu. Diolch I chi am ymuno. Thank you all for joining. We're delighted to have Dr. Alex Tomsett with us for this webinar. Thank you very much, Alex, once again for this webinar tonight. And if you'd like to ask any questions throughout the webinar, as you can see on the bottom of the screen, Q&A, you're welcome to ask these throughout the webinar, and hopefully we'll come around to answering all of them at the end. Therefore, I'd like to hand you over now to Alex for the next half an hour to 40 minutes, and then we'll go on to the Q&A before finishing. Thank you very much.
Thanks very much, Ellen, and good evening to everybody. Nice to see you again, those of you that have joined before, and welcome to those that haven't. I am Alex Tomsett. I work for the George Veterinary Group, and we are a dedicated pig practice in Wiltshire, and we work across all different shapes and sizes of pig producers, from small scale and pet pig keepers right up to larger commercial herds and integrated production systems. So quite a breadth of experience and knowledge within the practice. So today's presentation, as Ellen said, is going to be on parasites in pigs. So I'm just going to share my screen so you can all see the presentation rather than me. Okay. And there we go. So parasites in pigs and how to combat them. Just a starter for 10, a parasite is defined as a plant or animal that lives upon or within another living organism at whose expense it attains some advantage. So it parasitizes another organism in order to grow and reproduce, and that is likely to be at that other organism's expense. So in the case of pigs, it might cause poor growth rate or lack of performance for growing and finishing animals, or in sows and breeding herd, it's likely to cause a reduction in reproductive performance and may have some more serious effects in terms of causing mortality when you have heavier worm burdens. Parasites cover both internal and external organisms. So we're going to start with the internals, which is worms, and move on to the externals, which are your itchy, scratchy things like lice and mange. As with most of the presentations I do, pigs are good at having lots and lots and lots of things that go on with them. So I have picked the top worms and top external parasites rather than doing an exhaustive list, which would take quite a long time. If you do have any specific questions about something that I haven't covered, then please feel free to type a question into the Q&A and I'll try and cover it at the end. This is the overall programme, covering internal, so milk spot, lungworm, and some of the sow worms like red stomach worm and esophagostomum. Bit on coccidia, which is obviously a problem more of neonatal piglets, and then moving on to the externals. So we're going to cover what they do, how they exist, and what issues they cause with the pigs, and how we can control them and protect against them. Kicking off with the internal ones. Milk spot's probably the most common one that people are familiar with. And the reason why most people are familiar is because it causes lesions in the liver, which result in livers being condemned by their abattoir. And that often raises a question as to why are my pigs' livers being thrown in the bin? Why am I not getting the revenue back from them? What is the organism that's actually causing the problem? So it's commonly known as milk spot, but the correct name for the worm is actually Ascaris suum, and this is a large round worm that has a migration through the pig's body which takes in both the lungs and the liver. And the lesions on the liver are caused by the point in that worm's life where it migrates through the liver tissue, and the little white spots are effectively small scars that are left behind once the larvae have moved through. And these often resolve within about 25 days. So a heavy or any white spot on the liver, in the case of the picture that you can see here, a quite heavy infestation, they indicate a migration of ascarid larvae within that period of time, so quite recent to the point at which the pig's gone to slaughter. Just I probably should have sent a little bit of a health warning that I'm going to show some pictures of these parasites, and some of them are not particularly nice. So these are ascarid worms. They are clearly very large, visible to the naked eye. You can see the size of the blade in the left hand picture is probably about 3 inches long, so give you a bit of scale to how big that worm actually is. And the picture on the left is taken from a post-mortem that was done on farm, and the picture on the right is actually a worm burden that was found in the guts of a pig in a slaughterhouse by one of my colleagues. So they're not particularly nice as adults, and clearly you can have quite large burdens which come with its own level of problems. This is borrowed from the pharmaceutical company Hoover Pharma, and this is the life cycle of the ascarid suum worm. So you can see that you start with eggs in the environment, which is where the pigs acquire the eggs, and these then move in through the mouth and start to develop in different stages of larvae. So as they move into the digestive system, they then begin to migrate out to go through the liver. So the liver's the first port of call after they've been ingested. And then those larvae continue to move through the body, and they make their way out of the liver and up through the system into the lungs. And at the point they go through the lungs, you can see some transient coughing, and they can also be involved in triggering other respiratory diseases if there might be something sat in the background that otherwise wasn't causing a problem. The irritation of having the larvae moving through the lungs can cause additional respiratory problems. Once they've moved into the lungs, this is the point at which the coughing brings the next stage of larvae up into the throat, which are then swallowed back down, and then they develop into adult worms in the intestinal tract, which then start to produce eggs. And as you can see, quite scarily, female worms can produce up to 200,000 eggs a day, which are then shed into the feces and then contaminate the environment in which the pig's living, and the whole cycle starts again. It's quite easy to build up a heavy burden in the pig's environment once this life cycle started. And frustratingly, these eggs are highly resistant and very, very difficult to get rid of from the environment. Short of flame throwing or it's very difficult to reduce that level of contamination. So you have to take that into account in terms of deciding what your worming program is going to be, so that you can minimize the amount of infestation in the environment. Otherwise, it recycles itself quite quickly and will build up a higher and higher burden relatively quickly. You can see the whole cycle takes approximately 6 weeks from start to finish, and then starts itself all over again. To diagnose milk spot, there are several different ways in which you can attack this. As I've said, most people realise that there might be a problem because of the liver condemnations at slaughter, and that then triggers a need to do some further investigation. Post-mortem finding of either adult worms in the bile duct or in the intestine, or liver lesions, so these milk spot liver lesions, if you were doing an on-farm post-mortem, would give you an indication that Ascaris suum was a parasite that the pig was suffering from. And then you can do fecal egg counting, and I know some people use fecal egg counting in a similar way to you would do for sheep, as a monitoring tool to decide whether worming is necessary. It is worth bearing in mind that eggs are only intermittently shed in feces, because it takes that 6-week period to develop the adult to then start to produce eggs. And obviously, if you haven't got any adults already in existence in the intestinal tract, then they've already migrated through the liver, but may well not have developed into adults and started shedding. And therefore, you have to almost time it right in order to get eggs in feces to use that as a definitive diagnosis, at which point you may well have had liver condemnations or something else that gives you a better idea. There are blood samples available, some of which are supported by the pharmaceutical companies that make some of the worming products, and these are used mostly for late stage finishers in order to give an indication of whether those animals have been exposed to ascarids during their lifetime. And because it's showing the antibody that's produced in the blood, it will tell you whether the environment in which they've been living in is potentially contaminated, because at some point in that pig's life they may have been exposed. And that's quite a useful diagnostic tool, partly to evaluate whether there is exposure, but also to begin to evaluate whether cleaning and disinfection programs and parasite control programs are working effectively. In terms of control, they are quite troublesome to get rid of, but a regular worming program can help in terms of improving performance and reducing the effect that the infestation has on the pigs themselves, and also starting to reduce the level of contamination that the environment the pig is living in is exposed to. Obviously, if you're indoors and you have the ability to treat pigs and maybe not keep them in the same environment whilst you clean down, then that is of benefit. Also, pigs that live on accommodation in which the feces is readily removed from the pig, either a slatted accommodation or a scrape-through passageway where fecal contamination in the environment is minimized, then obviously you're removing some of the potential egg contamination of the environment from where the pigs live. One of the most troublesome areas is obviously pigs kept in paddocks outdoors, particularly if there's a limited amount of ground over which the pigs can move, as that means that pasture can become highly contaminated relatively quickly, and then you struggle to actually clean the paddocks up, because the eggs can live for 5, 7 or more years in the environment. And as I've said, they're highly resistant and therefore very difficult to kill. They're difficult to kill in buildings. They're nigh on impossible to kill outdoors. So having regular paddock moves and allowing ground to rest for a period of time, as well as a worming program, is definitely indicated. You can clean and disinfect buildings between occupancies, and that will help to reduce the burden. There have been products on the market that have had claims against worm eggs. Most of them were phenols and not particularly pleasant to handle. And if you are determined to try and do a really, really thorough clean and disinfect, it would be worth investigating whether you could get hold of any of these products. But bear in mind, they do involve some fairly hefty PPE and are not particularly pleasant to handle. So that's just worth thinking about before you invest in them, and that you have taken the trouble to get the correct protective equipment to be able to use them properly. So moving on, lungworm. This is mostly a problem that pigs that are kept outdoors for their lifetime are exposed to, because of the involvement of the earthworm in the life cycle of the parasite. So the parasites the eggs are shed into the environment from an infected pig and are then ingested by earthworms on the soil, and then the pig re-ingests the infection by eating the earthworm rather than eating eggs direct from the environment. This does not necessarily mean that it's purely for pigs that live outside all the time. If your pigs have contact with pasture or paddock, even for just a proportion of their life, then obviously there is a risk that they could become infected, and that's worth bearing in mind. These lungworms, as you can see in the picture, I have got an enlarged version of this picture that you'll see after I've gone through the slide, but if you can just see the little thready type black and white threads sort of in the center of the picture, those are adult lungworms that have been identified on post-mortem as they've been released from the lung tissue when the diaphragmatic lung lobes were cut and squeezed, and the parasites actually emerged when the tissue was squeezed. So they live in the lungs, and therefore they do cause coughing and they can cause breathing difficulties. It's mostly a problem of growing pigs because they are obviously younger and more naive, whereas adults can develop an immunity. It is difficult to find the eggs in feces, unlike other parasites, because they are difficult to find on flotation methods. So really the diagnostics for lungworm is through finding the adults on post-mortem. As I've said, temporary and or permanently housed pigs outdoors are the ones that are at most risk because of the exposure to earthworms. And one thing to bear in mind is, although worming is obviously indicated, you can potentially have an allergic reaction in pigs that have a very high worm burden in the lung. So it is just worth bearing in mind that although you will need to worm them, you can potentially see some negative interactions after worming if they've been heavily parasitized, because the lungs can react to the death of those parasites in the lung tissue. So hopefully my Wizzy animation has worked and you will see an enlargement of that picture just now. And you can see in the center there, you've got these little thready critters, and they are the lungworms that have been found on post-mortem. Moving on to something called thin sow syndrome. This is mostly caused by the red stomach worm, which is Hyostrongylus rubidus for its posh Latin name, but it's often in combination with Oesophagostomy, where you get a combined worm infestation causing problems with adults that will show inappetence and weight loss and anemia. And following on from the direct effect of the parasites on the adults' inappetence and weight loss, you'll then get a performance loss due to the fact that they're just in chronic poor condition. And because they are stomach-based worms, you can see some gastric ulceration, which can become quite serious if obviously that ulceration occurs in an area of the stomach where it can cause significant bleeding, which obviously adds to the anemia. Infection for this is mostly pasture-based, and it sort of follows the trait of some of the other parasites that other species are exposed to, where you tend to have a window during the year between spring and autumn where the infective larvae survive best on pasture, and therefore the risk of infection is greater during this time of year rather than over the winter period. And you can find them on fecal egg counting, so evidence of whether you have a red worm can be found by doing a fecal egg count. However, they look very similar under the microscope to Oesophagostomy eggs, and therefore you wouldn't necessarily discount this as being present. And likewise, because they often occur in combination, they tend to get lumped together a lot of the time. In order to actually find out which species it is, you'd have to hatch the eggs and go through a little bit more convoluted diagnostics. But just to get the basics, you can identify eggs on fecal examination. So moving on, the ones I've covered, so the lungworm, the ascarids, and the red stomach worms are sort of top billing in terms of most commonly seen eggs in worms in pigs. But we've got a few others that still have a role. The first of which is called Trichuris suis, which is known as the large intestinal whipworm. Because of its appearance, it looks a bit like a whip. So it's got a thick end like a whip handle and a thin stringy end, which looks like the actual rope of the whip. You can see from the picture on the right, this is a section of large intestine, and the little white lines you can see all over the surface are actually the whipworms, which are embedded into the mucosa. As you can imagine, with this level of infestation and the way they embed themselves into the tissue of the large intestine, they cause an inflammation, so a colitis, and alongside this often comes a diarrhea because of the inflammation of the intestinal mucosa. They're quite good at helping other intestinal pathogens to have a greater hold in the pig. Most importantly, you would obviously look at things like Brachyspirohyd dysenteriae, so dysentery, is often exacerbated by having a Trichuris suis infestation present at the same time. So you might get more extreme clinical signs, worse diarrhea, more prolonged effects if you've got the parasite working in combination with other gut pathogens. As you can see here, if you did a post-mortem and you saw those in the large intestine, that would be confirmatory, but you can also identify them as fecal egg counting. Often, trichuris is an incidental identification, often when diarrhea in pigs is not responding very well to other traditional treatments. So if you're treating for, say, a brachyspara or an ileitis and not getting a very good resolution, there's a possibility that that's because there is actually a worm burden alongside, which is not being dealt with by use of antibiotics. I've mentioned oesophagostomy already, as this works in combination with the red stomach worm to cause thin sow syndrome. Unlike the stomach worm, this is also a large intestinal worm like Trichuris suis, so acts causing inflammation of the large intestine and reduced absorptive capacity, and can cause diarrhea. When working in combination or individually, it will cause weight gain issues, and as a result of poor weight gain and poor sow condition, you will have poorer reproductive performance and reduced milk yields. One of my colleagues was actually involved in a study which identified some resistance to traditional anthelmintics, namely ivermectin, in this particular species of worm, and there are reports from other parts of the world of this worm showing signs of resistance to wormers in other categories. So it's worth thinking about that when considering what your worming program is going to be and how you're going to use it, particularly if oesophagostomy is part of the picture of parasites that you are looking to control. And I just threw in strongyloides, as this is something that particularly affects young weaners and young pigs. It isn't really very common in the UK because it is really in the realms of warmer climates, but this is unusual to the other worms because it can be transmitted via milk to the piglets. And this is one of the parasites in which you get the justification for worming the sows in advance of farrowing, because you're then protecting the piglets as well as deworming the sows, because you're then reducing either the chance of transmission through milk or the transmission to the piglets through a contaminated environment. It's not just strongyloides that this applies to. Most other parasites, a worming before farrowing would be of benefit in order to reduce environmental contamination that the piglets were then exposed to. So we've covered the internal parasites that you would know as helminths, and now I thought I'd do a very short bit on coccidiosis, as they are a parasite, but they fall into a different family because they're protozoa, not worms. This is mainly a problem of neonatal pigs, so pre-weaning, and often from as young as 7 to 10 days you might see clinical signs. That is not to say that you can't get problems in older animals, and we have diagnosed quite high coccidia challenges in gilts, in particular in gilt rearing systems. So don't completely discount it when you're looking into ill thrift and diarrhea issues in older animals, but it is less common as one of the differential diagnoses that you would think of. It is unusual in terms of a neonatal enteric disease in the fact that it doesn't really cause a high mortality unless it's involved with other pathogens. So if you have a combined infection alongside, say, an E. coli or a Clostridia, you're more likely to get piglets that die as a result of diarrhea. If they're purely affected by coccidia, it's often more of a performance loss and an onward performance loss that you would see due to the gut damage that the coccidia cause, rather than a high level of mortality. And you'd see white or yellow pasty diarrhea in the area where the piglets are living with the sow. And pigs of varying body condition, maybe looking a bit pinched and ill thrifty, rather than the pigs that are actually scouring very, very badly and then dying as a result of untreated scour. They can be treated with trimethoprim sulfonamides, which is TMPS. So there's various different products out there that fall into that family of antibiotics, and it might be worth considering using some electrolytes to address any mineral and salt imbalances as a result of the diarrhea. Mostly I would advise, if you feel that there is a coccidia issue in your herd, using some preventative treatment in order to stop the impact of the coccidia in the first place, rather than waiting for it to become a problem. This comes in the form of toltrazuril, commonly known as things like Baycox, or various different forms from different pharmaceutical companies, but Baycox would probably be the most familiar one. That's given either as an oral dose in early life around sort of day 3, day 4, but more recently a couple of products have come to market which are an injectable form of the toltrazuril combined with iron. So you get a double hit of managing the iron deficiency anemia that piglets can be affected by, along with managing coccidia. And obviously, as with most things in the farrowing accommodation, good hygiene is really essential in terms of controlling the environmental contamination, particularly between litters that might be using accommodation sequentially. Right, moving on to the external parasites. Mites, lice and flies. Those are the top 3 I've picked. There are some others, but they are much less common. Mites and lice being by far the most common things that cause itchy and scratchy pigs. Mange. So you can see from the picture on the right, we've got a sow here affected by a really nasty, crusty mange lesion inside the ear. And mange tends to focus itself around the ears, the neck and the head, but can cause some scabs on the insides of legs. And this crusting is how the mites manage to create a home for themselves, both by burrowing under the skin and creating this crust as a protective layer. Mites are incredibly itchy, and often you will see adults and growing pigs that are trying to scratch themselves or are rubbing against furniture and equipment in order to try and alleviate the itch of the mange mites wandering around all over them. So sometimes the first indication, if you haven't specifically noticed the itching, is that maybe you've got shiny surfaces, edges to feeders, edges to drinkers, very, very highly shined arcs in the field, which indicate where the pigs are actually rubbing against them. And this itching behaviour obviously leads to skin damage, where they might really itch to they're almost red raw, and those skin lesions can potentially become infected if left untreated, and if the mite infestation is left untreated. The other thing I have seen in infected herds is, particularly in growing pigs, the itching around the ears and the irritation inside the ears causes a lot of head shaking, and as a result you can get almost an outbreak of oral hematomas, which is where the ears become puffy and filled with blood, where the pigs are shaking them, or they get accidentally hit against surfaces and they almost get a big blood blister inside the flap of the ear, so it becomes swollen, and that sometimes might be the first indication that there's a problem, because you've got lots of pigs shaking their head and causing these oral hematomas. In order to identify whether there is actually a mange problem, then skin scrapes are required, and then you can find the mites in the scraped material under the microscope, and that would be diagnostic by finding them. One of the major issues is obviously it's a welfare issue, because they're so badly affected by the itching, but also because they're spending all their time itching, they're not eating as well, and that causes reduced weight gain. And then you can get little pimple-like lesions that appear on the surface of the skin at slaughter, which will devalue the carcass, because the skin would have to be removed, and that's called papular dermatitis. You can see here some pictures. You've got a pig irritated to the extent that it's trying to scratch, but you can also see how thickened and scabby the skin is in the pig on the right, and also the lesions around the back of the sow's ear on the left. where she's been scratching herself against pen furniture, paddock furniture, in order to try and alleviate the itch of the mites on the surface and under the surface of the skin. You can see the picture on the right is actually what the mites look like under the microscope, and this is what you would see from a skin scrape that is observed by microscopy. And obviously seeing these little critters under the microscope does give you a diagnosis of mange. This can be treated by injectable ivermectin or in feed ivermectin if the herd is of a sufficient size to justify putting medication in the feed. It is important to remember that to deal with the mites, which can persist for about 2 weeks and on the skin, it is important to do 2 doses 2 weeks apart to deal with the mites that are active at the point of the first dose and those that may have been hiding under crust or have hatched in between the first dose and the second dose. Obviously, we've talked about managing internal parasites to limit the transfer to piglets after farrowing. And obviously, if you have a mange issue within the herd, it would be worth considering a treatment with ivermectin pre-farrowing to try and limit the spread to the piglets. Older boars and sows can become chronically infected. They have very, very crusty skin lesions, which are difficult to tackle, and therefore these may need repeat doses if they are very, very crusty and have long-standing chronic infections. If you are considering using in feed rather than the guidance for the injection, which is just 2 one-off shots 2 weeks apart, obviously you're trying to cover the herd for the period of that 2 weeks, so you're giving them in feed medication for 10 to 14 days in order to tackle the infection properly. There are guidelines on how to eliminate mange from herds. That's possibly a little bit beyond the scope of this talk, because we're talking mainly about combating infections and preventing infections coming in. But if you do have a mange infestation issue and you're considering whether to completely get rid of it, it is a potentially something you can do using ivermectin medication and putting a strategy together. The best way to stop it coming in is to make sure that you either purchase stock from mange-free herds or ensure that incoming stock is properly quarantined and treated with 2 injections of ivermectin 2 weeks apart, or a course of in-feed ivermectin before they are introduced to your main herd. Lice. These are particularly unpleasant because you can see them when they're walking around on the surface of the skin, and immediately makes me want to itch. So they're quite big, seen with the naked eye, often visible around the neck of the pig. But if you can't physically see the lice, then again, as with mites, excessive scratching, polished clean pen furniture or arcs, and broken hairs would indicate that there is something occurring with the pigs that are causing a great amount of itchy behaviour. Often lice and mites are confused with one another because you don't always see the specific cause of the itching. You can just see lots of very, very itchy pigs. So pleasingly, the strategy for managing lice is very similar to the strategy for managing mites, and that is a course of ivermectin. These don't survive as well off the host, so the prolonged need for treatment is not quite the same, because if you treat them and then move to a clean environment, then you are unlikely to have an infestation follow you. But similarly to mites, the best way to keep lice out is to make sure that you just don't buy them in. So check with the people that you're purchasing pigs from whether they have a lice problem, whether they do routinely worm or deal with parasites in their pigs, particularly external parasites. And if you are purchasing, then consider a quarantine period so that you can deal with some of these issues before the pigs are introduced to your existing herd. Finally, flies. I thought I'd mention this because it crops up annually, issues with flies, in particular biting flies around sort of late May, June, early July time, when they seem to come out in force, and that's when most people struggle with issues with fly bite lesions on carcasses at slaughter. Biting flies particularly can cause a lot of skin damage and irritation, and as I've mentioned, can cause carcass condemnation or skin condemnation due to these little bites or similar to papular dermatitis lesions that are found at the slaughterhouse. But they do highly irritate the pigs, and in a similar way to the way other external parasites will reduce weight gain and performance due to the level of irritation, then it is worth considering how annoying the fly population is in a pig herd and what impact that's going to be having on the pigs in terms of their performance. They also spread disease, so they're not shy in moving between different populations of pigs or from infected fecal matter on another herd and then moving to a herd that might have not been exposed to whatever was in the feces of a neighbouring farm. So it is in your interest from disease control to keep your fly population low so that it's not potentially either transferring disease between pig herds or around different categories of animal within your herd. Flies tend to build up in areas where there's crusts on the surface of muck, so they can get in and lay their eggs underneath the crust, and then the maggot population develops underneath the crust on the top of muck and slurry, and then they emerge and create the next generation of flies, and often a greater number than you initially started with. So controlling muck and slurry levels, regularly removing that from the pig's area and keeping muck heaps to a minimal or at a distance from the pig herd, keeping slurry pits low so that level of slurry with a crust on doesn't encourage development of the fly population. There are treatments out there for managing the fly population, both within slurry pits and on muck heaps, and there's a multitude of different knockdown sprays, fly papers, granules that you can use in order to try and control the flies within the pig's environment. Everybody always asks about treatment, so I thought I'd do a quick table just to take you through some of the options. They are relatively limited in terms of the number of compounds that are available, but you can see most of them cover the wide range of internal parasites, and obviously ivermectin is the only generic compound which covers external parasites as well as internal parasites. Be aware that some of them come in a method of administration which may determine what your choice preference is depending on your size of herd and how easily you find administering different types of medication. You can see that the two families of worm are the fenbendazole and flubendazole, which tackle the internal parasites, come in oral preparations, which can be available in feed or in water. And the benefit of in water preps being available now is that you can dose a smaller number of animals more accurately without having to medicate a huge volume of feed. Ivermectins do come in an oral form, but that is only in feed, which obviously impacts on those with smaller size herds which just don't order the volume of feed in which you can get that tonnage medicated, which limits most smaller scale pig keepers to using the injectable form of ivermectin. It is worth bearing in mind that there are a multitude of different brand names that fall under these different categories, and they have claims against different stages of internal and external parasites. You note from the comments that some of the fenbendazole products do actually claim that they can kill the worm eggs, which obviously if the pig is ingesting the egg from the environment and is under treatment, it would then deal with that newly ingested egg, which obviously helps to clean up the environment. But not all of the products are licensed for doing that. So you do have to speak to your vet and discuss what is most appropriate, both for the type of worms that you're trying to combat and also for the breadth of coverage that the different products have. It's also worth bearing in mind that there's different treatment regimes for some of the internal parasites versus others. Namely, Trichuris suis often involves a longer period of treatment than the other internal parasites. So again, if you have a diagnosis of Trichuris suis within the herd, bear in mind how you have to amend the treatment period in order to tackle that properly over and above what you would have done for some of the other internal parasites. Finally, the treatment strategy you would use in your herd is very much dependent on the parasite problem that you are presented with. Are you dealing with just internal parasites? If so, which ones? As we've just discussed, it might determine the length of treatment required. If you're dealing with external parasites and internal parasites, then obviously you are left with a limited amount of options in terms of the compounds that you can use, because you need to tackle both at the same time. If you're just dealing with external parasites, the product will cover any internals that you hadn't thought might be an issue. Also, you need to consider the extent of the problem through whichever diagnostics that you have available, either say liver condemnations for milk spot or post-mortems that have been carried out, or alternatively by using fecal egg counting. And then, as I've mentioned previously, the ease of administration of treatment, which is the method of administration that best suits you and your pigs in order to make sure that it's done accurately and effectively. And I've put a link there to the RUMA guidelines, which is the Responsible Use of Medicines in Agriculture page. And they've got a really nice guide to how you can evaluate what's going on in terms of parasite burden in pig herds, and then the different scenarios and different options in terms of management and control that might be open to you depending on what's been diagnosed and what sort of pig herd you've got. So I thought that was quite a useful link to cover a multitude of different things, because everybody's situation is likely to be different.